You're listening to the Nutrition Experts Podcast, featuring guests who take the scientific talk about food and break it down for practical use. You've heard the phrase, "You are what you eat." Come find out what that really means. Experience conversations with experts in the field of nutrition and understand the power of food for our health, well-being, and beyond. Now, here's your host, registered dietitian and nutritionist, Mathia Ford.
Hi there, it's Mathia. Welcome back to the Nutrition Experts Podcast. The podcast featuring nutrition experts who are leading the way using food starts today, right now, with our next guest. It's great to have Amy Goldsmith on the show today. Amy, welcome to Nutrition Experts.
Thanks so much for having me.
I'm excited to have you on the show and share your expertise with my tribe. So tell my listeners a little bit more about your expertise, what you do.
Okay. I have been a dietitian for 20 years. And about 10 years ago, I opened Kindred Nutrition, which is a private practice. And we specialize in eating disorders, treatment, sports nutrition, and GI health. We also focus on community outreach. And recently, I accepted a position on the board of directors with the Maryland American Nutrition and Dietetics as the Consumer Protection Coordinator for MAND.
Wow. So that is a lot of stuff. So you mentioned that you help with eating disorders, sports nutrition. Kind of what's the biggest issue you usually find your patients need you to help them work on?
Lots of times, unfortunately, I feel like patients are coming to my practice as a last resort. There's lots of information out on the website or some quick fixes that are sold. And after trying and not getting the results that they want, clients will come to me for some evidence-based help. I really start working with them on the acceptance of their current state of mind, putting appropriate goal setting in place, providing education, and then focusing on accountability.
So regardless of what their problem is, you kind of help them get a better understanding of their issues and then like a path that you help them work down?
Yes, I feel like it's really important to help my patients have the right mindset. So we work on that first, and then we focus on the education and then the goal setting.
So you also mentioned eating disorders and their treatment. Can you talk about, maybe our audience doesn't necessarily know exactly what an eating disorder is or what might cause them. Can you talk a little bit about what those are, what you see in your practice, and where they come from?
Sure. There's not a lot of research that can pinpoint exactly what an eating disorder is from, but there's some research that shows there's a genetic predisposition to mental health, such as anxiety or depression or OCD. And the eating disorder can co-occur with that and be used as a need to cope or find a way to believe they can control something. I see in my practice, too, that there's environmental triggers that can kind of lead to an eating disorder as well. Sometimes, depending on the environment, my clients feel so out of control. When they start to focus on the black and white, it's a little bit easier for them to distract themselves from that emotion and really say, okay, let's make some rules. I'm going to eat this amount of calories. I'm good today. I'm bad today, and et cetera.
So what typical eating disorders do you see?
So I would say the typical eating disorders that we see here is anorexia nervosa, which is more of restriction, overexercise. We see binge eating disorder and bulimia nervosa. We are also starting to see a rise in orthorexia as well.
What is orthorexia?
So orthorexia is obsession with wanting to eat specific types of food. So it's similar to anorexia with restriction and maybe overexercising. But it is that particular individual wants to be very aware of everything that goes in their mouth. I don't like to pinpoint the cause of eating disorders on anything specific, but I would say it's similar to the person that you might know who will only eat clean or will not have any added sugar, or, and they make rules, and if they can't follow that, it completely disrupts their day.
What are some signs that someone might have an eating disorder, or that a professional, we have some dietitians, doctors, nurses that listen to the podcast. What signs would a professional see to indicate that might be an eating disorder?
That's a great question. It's hard because I think a lot of the colleagues that I work with, we're lucky from a dietitian end because we get 45 minutes to an hour to spend with our clients, and we're trained to motivationally interview. So I think that's an obstacle sometimes for some of our colleagues because they're really in and out, in 10 to 15 minutes. So unfortunately, one of the only signs that physicians may see is a change in weight or a change in labs. But when you are motivationally interviewing someone, you can kind of determine if they are skipping dinner, if they are focusing on healthy eating in an excessive way, if they are isolating themselves from family and maybe starting to make their own meals, not eating with others, or leaving during meals to use the bathroom, for example. So I feel like it's hard to determine if somebody has an eating disorder if you're not trained to take the time to really be investigative of that relationship with food.
Yeah, and I think by the time the weight loss shows or those signs that would be more evident, it's gone on for a while, because I think people tend to be able to hide these fairly for a while.
Absolutely. And I would say, with some of the eating disorders, we don't see weight loss. And so if you're trained in kind of that black and white thinking, it's easy to say, well, they're stable. So it's tricky.
Do you usually see eating disorders for women? Because I know that's a pretty typical thought that I've heard. Or is it equal men and women? What about athletes or young or old? What type of person is most likely, you think?
I first actually started to train more with eating disorders because I worked so much with athletes, and I was absolutely, in my younger years and early on in training, I was absolutely shocked at how many athletes had disordered eating. But as I worked with athletes, it kind of made sense to me because there's such pressure on performance. And if you think about it, even in the media, you hear people say, that you have to be a certain race weight, runners have to be a certain race weight, or wrestlers have to be a certain weight. I mean, we have football players weighing in before season, high jumpers have to weigh in, so they're using the correct pulse. So it surrounds that athletic field. But I would say, when it comes to my practice, there's a higher percentage of women, but I see both males and females and all ages. Matter of fact, one of the things that's been a little bit troubling is that I'm starting to see eating disorders at a very young age. So I have lots of 8 and 9-year-olds, and that's really been a change that I've had to get used to.
So would you say with the younger crowd, does it kind of seem to start with picky eating and then go from there? Or is it the athletic stuff, the trying to do better with that?
I feel like it's a perfect storm with the younger kids, which kind of sounds silly.
Social media.
Right. Social media. My clients who have eating disorders are very, very smart, high achievers. And it could be one little trigger that starts that eating disorder. So maybe it's, maybe that child was bullied, believe it or not, and they weren't able to talk to anybody about it. And they felt so out of control because of the way that's making them feel. They start to focus on what they're putting in their mouth, subconsciously. But then they lose weight and people are giving them positive feedback. It could be, believe it or not, this is something that I've really tried to get a grasp on, but health class, believe it or not. If you have a child who is type A and maybe a little bit obsessive compulsive, imagine what they process when they hear in their health class that if you eat sugar, you're going to get cancer. It's very, very scary to that individual, and it may make them want to really change their eating patterns. And the picky eater as well. I think the longer picky eating goes on, I think it really creates a lot of fear with trying new foods. It's not necessarily that they have a issue with body image, but they just become so fearful from food they can't move forward.
So I was kind of surprised this last time when I went with my daughter. She's 13, and we went to the doctor, and she was mentioning her height and weight chart because it was her annual exam, and she was telling her she's gaining a little too much weight. I was just like, let's not focus on the weight. Let's focus on activity. We've decreased activity, so we need to do a little more activity. And obviously, eating choices could be better, but And I also know that her weight fluctuates. I mean, so I was kind of disappointed to hear the doctor say that, because I was like, oh, you just put weight into her head as an issue.
I know. And I feel like there's been such a high intensity training for physicians. Like, you have to identify childhood obesity and we need to squash this. So, when there's pressure like that, I think it does kind of create this checklist, right? So they do the weight, they do the height, they check the BMI. Oh, BMI is too high, but BMI is not the best indicator. It doesn't take muscle mass into consideration. They didn't really do enough to really look at children from, as far as a BMI standard. So there needs to be a little bit more questions that are asked when they look at weight, plus lots of times as our kids grow in height, we expect the weight to follow. And I think sometimes that's forgotten.
Yeah. Yeah. It's still at 13, still very transitional weight, height time. So is there any tips or thoughts that you might give other dietitians to help someone or just in the way we talk to people, to help with addressing kind of that issue, if that makes any sense?
Yeah, that makes a lot of sense. One of my best friends is a dietitian. We met at her first job, and cracks me up because she says, Amy, my gosh, I see more eating disorders in my practice than I would like to, right? And she says, but lots of times it's confusing because they come to me for weight loss or, something like constipation or something. And she really will dig down and ask lots of questions, but she really doesn't feel comfortable working with eating disorders. And I try to normalize that and say, yeah, that's, I'm not the best with diabetes, right? Like, I'm not up to date on the newest insulin pumps and, glucose testing and that sort of thing. So she's gotten to a place where she assesses for the eating disorder. She normalizes it, and has a pretty good try where she is. So she says, I don't really think that you have the best relationship with food. I have a great colleague that I think you may be able to work with, and, I'm not abandoning you, but this would be somebody else that we could work on our team. So she's not afraid to refer that patient out. And I think sometimes when dietitians are younger in the field, they kind of would see that as failure, if they were, but we all have a specialty. That's why there's so many of us. And it's okay to say, I hear where you are. I hear what you're saying to me. I'm not the most comfortable with it. It's my job to get you the help you need. Here's my recommendation.
Yeah, I love that because I'm a specialist in kidney disease, renal nutrition. So I don't know a lot about cancer, and I have friends who get cancer and they'll say, what should I eat? And I say, you should find a cancer, talk to the dietitian at the cancer center, because I have general knowledge. But so I think that's an excellent point, that it's not a problem to refer somebody, especially if you're helping them. And we have in Oklahoma, we have a little group on Facebook that's just our RDs in the state. And we kind of go in there and I'll see things, pediatric dietitian who takes our state Sooner Care, for a failure to thrive in Tulsa, for example. So they're trying to find someone to help those people. So if you have that resource in your area or you don't have it and you want to start building one, I would recommend that, because it is, then you, like you said, somebody and that they're going to help. So, and they have that specialty. So talking about consumers a little bit, you mentioned you're going to be the consumer protection person for the Maryland, is it
Maryland Academy of Nutrition and Dietetics? Yes. I always get them mixed up.
Yeah. So talk about being a better consumer. What does that mean?
We live in such a different time than when I've been a dietitian for 20 years. So it was very, very different when I became a dietitian. And I feel like nowadays you can go on just the computer and Yahoo and Google they have ads running based off of your search engines, which always cracks me up because I'm a dietitian. Don't try to sell me, your magic pill, but
we always say Dr. Google.
Right. But, and we also, I would say, obesity has risen and there's a lot of attention paid to health. But the nutrition or nutraceutical business, it's a multi-billion-dollar business. their goal is to make profits. And I hate to simplify it like that, but it's true. And they market to the consumer who is desperate or frustrated or sad or wants a quick fix. And they make it at a little bit more of an affordable price because they can get the volume. So that's one of the things that I hear a lot is if I don't take someone's insurance, yes, it is a discretionary fund to spend to see a dietitian. And it's not going to be as cheap as some of the shakes or some of the, even the medication that some of the physicians are prescribing. But that's because there's a lot of investigative work and it's individualized, right? So these nutraceuticals, they can sell something for $19.99 because they're going to sell it to millions of people. Also, I feel like we're in this new era, which I'm really trying to calm myself down a little bit about. But there are a lot of people who really do get into nutrition. Athletes, they really do notice that they have a change in performance when they eat right. Women who have lost a certain amount of weight doing something specific. We've even got some pyramid schemes that go on that boast their individual experience. That experience does not give somebody the credentialing to be able to really determine what an individual needs to lose weight. And I know that lots of times people say calories in versus calories out, that equals weight loss. I'm here to tell you that's not necessarily the truth. There's a lot that goes into weight loss, which is why dietitians have to take biochemistry, organic chemistry, anatomy and physiology, on and on.
So how can people be a little bit better consumers related to food?
I feel like if they have understanding of marketing, if there's a particular food that's marketing, success, see if there's any research behind it. And if there's any research behind it, see who paid for that research to make sure that it's not biased. I also think that if you're going to someone who is going to be your nutrition coach or your life coach or your nutritionist even, do a little bit more research to see what experience they have. I feel like I'm a great mom, but I'm not going to start a business telling everybody how to be a parent. I just think it's really important to see where that person got their education.
How can people be harmed by or, not helped by talking to someone who is not necessarily trained, but just kind of has this experience of either being part of a multi-level nutrition marketing scheme or even have gone to some training, but not, or lost weight. And like you said, you're a great mom, but you're not going to necessarily write books and coach people on how to be a mom. So how does that affect people? What's the harm in that?
Well, lots of times some of the programs will have people restrict a complete group of food. So either restrict grains completely, I'm just using it as an example, or cut them. And we know as dietitians that that affects the biochemistry within the body. And it also affects your lean muscle tissue versus your fat muscle tissue, which affects your metabolism. So you may see the quick fix and the weight loss, but long term, you may be increasing your fat mass, which is more dangerous to your heart health. You may be decreasing your muscle mass, which will affect your metabolism in a negative way. You're removing an entire food group. So if you're not checking your labs and that sort of thing, you may be creating a deficiency within your body. So it's not a one size fits all. It's the same thing with lots of times I work with vegetarians who are athletes, and I'm not against it. And I meet all my clients where they are, but every vegetarian should be checked to see if they have an iron deficiency, right? And they have to go to the right person who knows how to assess that to improve their quality of life and their health.
So I know as dietitians, we're often trained to do some physical exam assessment to look for those nutrition deficiencies. And I think that that's something that when we look at somebody, we're taking into account all their, whatever you'd call it, comorbid conditions. Maybe they have diabetes and they're taking insulin, and all of a sudden you tell them to not eat grain or flour products. That's a pretty significant change that someone who may have lost weight and doesn't have those issues may not recognize that the diabetes, the insulin is going to get them too low, and they could potentially have a low blood sugar, which hypoglycemia, which could be very bad.
Absolutely. We're trained to look at the whole body. I always tell my clients we're trained to look at the body from the moment something hits your tongue until it comes out of your body and everything that goes along with that, which I think is unique.
Yeah. I just think people want that quick fix, and it can be more expensive to see a dietitian. It can take longer to see results. So I think that's what's hard for consumers, because they're so used to that quick fix, and they see these beautiful sculpted bodies on Instagram and they say, I took this supplement, you can too. So I was watching this past December, the Heisman Trophy win by Kyler Murray, who is from Oklahoma. And he mentioned the nutrition staff as being part of the reason why he was so successful. And I was so appreciative of that, because I know they have a dietitian, and I am so excited that a lot of the colleges are starting to utilize dietitians and realize that, like you mentioned, they can get eating disorders, they can get other issues. They have dietitians teaching them in all the sports, not just football. I've talked to the Oklahoma dietitian, and she helps with golf. She helps with women's softball. She helps with baseball. She makes sure they're hydrated. You know, she gets them kind of ready, and she also manages their training table, you know, what they eat. I think that's great that colleges are starting to recognize that it's a performance improvement when you have a dietitian helping you with sports nutrition. So can you talk about kind of what you do with athletes besides the eating disorders that help them with sports nutrition?
Yes. So sports nutrition, they're really fun because they're so motivated, and they have pretty specific goals usually. And, you know, I think by the time people are athletic, the goals aren't completely unattainable. So they're pretty realistic, which is neat. I think a lot of people are surprised with how much nutrition can help performance and recovery. Because I even think about, you know, I'm in my 40s and we didn't really talk about nutrition at all as it's related to performance. So I assess people's needs based off of, you know, their general anthropometrics I get, but then also really, really dig down into their activity, which is fun for me. I love to do that. And then even break it down even more into, okay, this is what your needs are, but we can even focus on timing of the meals. So, you know, if you eat this particular food a half an hour before you start this activity, you're going to get energy for this long. And then within 30 minutes after your activity, let's recover. And we look at really key things. So how do you feel 10 minutes into the workout, 20 minutes into the workout, 45 minutes into the workout? How do your muscles feel? Like, are you seeing a decrease in your delayed onset of muscle pain and that sort of thing? So, and then I always tell my athletes, you know, you train for an event. So we don't expect nutrition to be 100% correct, like the prescription that we're putting in place. You have to train for your nutrition. But I would say, I mean, all of my clients are always shocked once they hit that right nutrition kind of prescription. And it's so fun. Like the Marine Corps Marathon is here every year, and my phone is going off like you wouldn't believe with text messages from my clients. Oh my gosh, I got a PR. I felt great. I was hydrated. And what's better than that? It's so cool.
It's towards the end of January when this is airing. Most people had New Year's resolutions and may have given them up by now. But any ideas or tips related to exercise and nutrition to keep from overdoing it and kind of staying the course if you're like, okay, I gave up, but maybe I could start back in a more reasonable manner?
One of the phrases that I always say that I think initially might turn people off is you can't exercise a bad diet. You can't out-exercise a bad diet. So, you know, oddly enough, people always say to me, are you gearing up for January? You must be really busy. It's our slowest month at Kindred Nutrition. I mean, everybody's joining their gyms and, you know, starting their shakes and that sort of thing. April's our busiest month because by then everybody's kind of decided that they want to take a new route. You know, your goals have got to be realistic. I do think there's something about starting a new year and being positive and I'm going to make this year great, but you don't have to make the year great by telling yourself you're going to get up at 5 o'clock in the morning, 5 days a week to exercise for 45 minutes if it's not something that fits in your lifestyle. And also, I'm a huge promoter of physical activity, but I look at physical activity more as an endorphin producer, stress reducer. 45 minutes of working out is great, but if you're not eating the right way, it's not enough to help you lose weight and get to that magic number that you're looking for, if that makes sense. So I'm a fan of SMART goals. I know that's really, really helped with our clients here. And we actually even have a sheet. SMART goal stands for a specific goal that's measurable, that's attainable and realistic, and then it has a time expectation.
Thinking about setting goals and just being reasonable, I also know that we just mentioned people want quick fix. Exercise does take time to kind of see the change. So does a diet a little bit, but I think you can see it a little quicker with a diet. Maybe you got burned out because you were sore after 2 weeks of working out every day for 45 minutes, and be a little more reasonable, find that good place. I know a lot of times we can't see the benefit of exercise till all of a sudden we stop for like a week on vacation and we're like, oh my gosh.
That's so true. Coming back to being active after being on vacation, you're right. That's a good way to like positively reframe it. Like, wow, I was in better shape. Like I was in good shape.
I was in great shape. Look what happened.
But the positive thing about that is you do have muscle memory and you can build it back up.
I think that's absolutely true. You don't have to give up and fall off the wagon and not get back on it. So Amy, my favorite question to ask everybody is, what's your favorite food? Since we didn't talk a ton about food, but I'd love to hear what you love to eat.
Okay. So I even though I'm a dietitian, my favorite food, believe it or not, is chicken wings with really good blue cheese and spicy, hot and spicy.
Yeah. That doesn't matter that you're a dietitian. I used to, when I was in the Army, I would be in the grocery store in the commissary on post, and I'd be shopping and people would come up to my cart. What are you buying? I'm like, don't look at my food.
Oh, Frederick is a small town. That happens to me sometimes in the grocery store. It's funny.
Yeah. So Amy, thank you so much for being on the podcast today. It was a pleasure to have you on the show. I know my listeners learned a lot about just eating disorders and sports nutrition, kind of dealing with that. So if listeners want to connect with you, what's the best way to do that?
We have a website, www.kindrednutrition.com. And we also are on social media. And Instagram, we're Kindred Nutrition Reel, like REEL, and Facebook, Kindred Nutrition.
Great. Well, guys, this has been another great episode of the Nutrition Experts Podcast, the podcast that is all about learning more so you can do more with nutrition in your life.
You've just listened to an episode of the Nutrition Experts Podcast. Be sure to get more information about this week's episode at www.nutritionexpertspodcast.com. Tune in next time for another great conversation with a nutrition expert and expand your personal knowledge in the field of nutrition, one conversation at a time.